Thank you for everyone that is already in attendance. We will be getting started in just another few minutes. Thank you. All right, thank you all for joining us today for kicking off the school year in a healthy way, presented by Healthy Schools campaign. We're going to go ahead and get started. I want to be mindful of everyone's time. I do appreciate everyone for being punctual. So what to expect from this webinar? We'll be going for approximately an hour. A recording of the webinar will be available and sent to you at the conclusion, probably tomorrow. And if you are looking to get your clock hour, please go to the handout section that should be in your toolbar. You would have to download the evaluation form, fill that out, and send that back to me. ISB does require that you also send me your IEIN number. And once you do that, I'll then send you your certificate of completion for your 1 clock hour that is going to be awarded for this webinar. Throughout the webinar, we will also be launching a few poll questions. Please take a few moments to answer those as they come up. And at the end, please also take about 1 minute to complete the survey at the end of the webinar, which will also be emailed to you. At the end of this, we will be taking about 10 minutes or so to answer any questions. Throughout the webinar, if you do have any questions, feel free to chat those to us, and we will make a note of them and answer that toward the end of the webinar. So please, you do not have to wait, just send those as they come up. And again, most of you are aware of this. We do have a few webinars throughout this series that are going to be going on throughout the school year. These are those. And to launch our first poll question, I would like to know, when is the best time that is most convenient for you to participate in these live webinars going forward? So please just answer that. And while I introduce myself, for those that do not know me, I am Kenneth Varner, the Community Engagement Manager with Healthy Schools Campaign. My role here is to help schools with their implementation of wellness policies and helping you troubleshoot all of that, as well as helping you to create healthier environments throughout the school day. And we'll go ahead and close that poll. All right, so thank you very much for answering that. A little bit about Healthy Schools Campaign. We are a nonprofit that was founded about 15 years ago and is based in Chicago. Our mission is to make sure that health is incorporated into every aspect of the school experience. We operate on the premise that healthy students are better learners, and we work to create healthy environments where students can learn and thrive. By helping to instill healthy habits in students, we hope to not only make positive impacts on the life of that individual, but to make positive impact on entire communities and make that generational change. So what do we mean when we say, what is a healthy school? It is a school that understands and supports students' well-being and sees students as a healthy foundation for learning. It is the environment that provides good nutrition, physical activity, basic safety, clean air and water, and access to health care and health education to help students make healthy choices that allow them to thrive. Access to care includes physical, behavior, and mental health, dental and vision, prevention, screening, and disease management. In a healthy school, students learn through lessons and through examples to value their own health and that of their environment. Here you'll see a graphic that explains the whole school, whole community, whole child framework that was developed by the Center for Disease Control. This graphic illustrates that the child at the center and is surrounded by the components that influences the child's health outcomes. As you can see here, we all have a role to play. We have to create an environment for that student to thrive. We also have to provide the wraparound services to uplift that child. The schools play an important part in this, and it is through the partnerships of all those concerned that the best outcomes can be reached. In the Healthy Students Are Better Learners report, Charles Bosch clearly states that no matter how well teachers are prepared to teach, no matter what accountability measures are put in place, no matter what governing structures are established for schools, educational progress will be profoundly limited if students are not motivated and able to learn. Health-related problems play a major role in limiting the motivation and ability to learn. And students are especially not able to learn if they are not present in the school building. A major contributor to chronic absenteeism is the management of chronic health conditions. If we are able to lessen the prevalence of chronic diseases or provide an environment that better manages those conditions, we can keep students in the building more often and therefore lessen the negative impact on educational outcomes. The next two slides that I have provided here, I've included those to help you make the case for creating healthier environments in your school building. Please share these with parents, teachers, and your administration. These charts show the academic outcomes associated with specific health practices. For example, if a teacher wants to If a teacher wants students that show up late to go directly to class, you know it's important to participate in the breakfast after the bell program because evidence shows that skipping breakfast is associated with decreased cognitive performance, which lessens that child's ability to learn. Similarly, when a teacher is hesitant about incorporating physical activity into their lesson plans, you can simply tell them that adding just one physical activity lesson per day creates a 21% decrease in the amount of time teachers have to spend on behavior issues, which I'm sure they would be interested in learning. And while I'm introducing our guest presenter, I would like to know about those of you in our audience, so we're going to launch our next poll. I would like to introduce a good friend of our organization, Sarita Sheely. She is the Healthy CPS Specialist with CPS's Office of Student Health and Wellness. She has assisted us with many webinars in the past, and it is a pleasure to have her back, so thank you for being here.
Thank you.
And with that, I would like to close that poll. And we do have a good amount of wellness champions, so thank you for being here, and we have a good amount of teachers as well. And with that, I would like to hand that over to Sarita.
All right, thank you for having me. Again, my name is Sarita Sheely. I'm the Healthy CPS Specialist for Chicago Public Schools. I'm going to begin by going over a brief introduction of the Office of Student Health and Wellness. The mission and vision is here, so we aim to eliminate health-related barriers to learning and advance health equity in Chicago. This is our organizational chart. If you did not know, we are divided into 4 different teams. I am a part of the health information team, so I do a lot of information on communications, technical assistance, surveys, and data management and reporting and evaluation, and that is the same team that does the Healthy CPS survey that goes out every spring. So as you can see, a lot of our work comes from the Health Promotion Office, which is where we talk more information about school gardens, Learn Well, school food promotion, and the wellness policies. And then another good chunk of our work comes from the Student Health Services and our Children and Family Benefits Unit. So what is Healthy CPS? So Healthy CPS is an initiative that is comprised of 48 plus health and wellness policies. And to help our schools digest those policies, we created the Healthy CPS Indicator. And so this health focus measure is included on every school's progress report. And I'll show you how to locate the actual report and how to see exactly where a school stands later on in this webinar. And we also help partners identify if schools are actually meeting those policies and initiatives that focus on chronic disease, health services, health and physical education, as well as school wellness. So again, there's 48 federal, state, and local wellness policies that are under the umbrella of Healthy CPS. And the badges, are chronic disease, instruction, Learn Well, and health services. And I'll go in a little bit in a second on those badges. Just want to make you all mindful of the 5-year vision. This has been made public since this summer, and Dr. Jackson and Chief McDade talk a lot about it. If you're not aware of it, please make sure you download the 5-year vision and see exactly what CPS will be up to for the next 5 years. I do want to call out, again, the whole child. So as Ken stated a second ago, the WISC model is definitely in our core values for the 5-year vision. So we want to keep everything student-centered. We want to make sure that we're supporting the whole child so that they are healthy, safe, engaged, and academically challenged. And we definitely want to focus on equity, so making sure that our students and schools have equitable access to resources, so that we can provide academic excellence and continue community partnerships and continuous long learning. Within the 5-year goal, I want to make sure that I'm calling out the fact that we want all of our schools to achieve Healthy CPS certification, so 100%. I can say that for school year 18-19, even though the reports have not gone out just yet, they will go out this week. So far, we've had 90 schools to actually achieve Healthy CPS status. So that is a remarkable feat for last school year. So we're hoping to double that for this school year 1920. So why do schools need to be healthy CPS? One, healthy kids attend school and achieve higher academically. That was stated in the Bosch review. And we want to make sure, well, schools have to adhere to the directives of the following policies. This is just a snippet, but there's actually 48 total. So we want to make sure that schools adhere to the Federal Education and Nutrition Policies, the Illinois State Board of Education Policies, CPS's Local School Wellness Policy, CPS's Healthy Snack and Beverage Policy, the ISB and CPS Sexual Health Education Policy, ISB and CPS Physical Education Policy, CPS's Guidelines to Support Gender Diversity, and the Illinois and CPS Medical Compliance Policy. So this is an example of the district report. Of course, there will be a new one for school year 18-19, but for the webinar today, we'll go over school year 17-18 data. So 79% of schools last year took the survey, and of those schools that took the survey, 76% of schools aligned to healthy CPS criteria. So it was pretty good, but we're definitely hoping school year 18-19 data shows more compliance. How to access your report. So you will go to cps.edu, our webpage, go to the schools page where you go into school profile, type in the school name, and then download. Click the Download tab, and then scroll all the way down to the bottom, and you'll be able to see the Healthy CPS report. So right now you'll be able to see for school year 16-17, then you'll be able to see the report for 17-18, and then hopefully later this month, you'll be able to see the reports for 18-19. And this is an example of what the reports will look like. This year, we did change the actual indicator. So the percentages will actually be on the actual indicator as well as in the actual report. So that it doesn't look like schools are not achieving healthy CPS. So we're actually putting the percentages there. So you'll know exactly where they lie. So to go into detail on healthy CPS, we want to start with the first badge, which is the chronic disease badge. And this covers everything from asthma to food allergies and other chronic conditions. So based off of 17-18 data, only 29% of schools actually had staff to complete the chronic conditions training. Now this training is mandatory for all staff. And when we say all staff, we want it to be known that that includes lunchroom staff and security. So not just your teachers and admin in the school. All staff, even parent volunteers, if they are around children for more than I think it was 5 hours, have to complete this chronic conditions training. And it is located on the Learning Hub, and we can get that course code to you for this school year. So on average for last year, 42 employees were trained, and this year we're hoping to have an increase for the chronic conditions training. So again, it helps and prepares staff to respond to asthma, food allergies, or any diabetic-related emergencies. For the instruction badge, everything here concerns high-quality instruction within CPS around the areas of sexual health education, physical education, and nutrition education. Sexual health education and physical education have minute requirements for instruction. Nutrition education does not. Based off of last year's data, only 28% of schools met the criteria for sexual health education, so the minute requirement. For physical education, 31% of elementary schools and middle schools met the requirement of implementing 150 minutes weekly in PE, and 57% of high schools met the requirement of implementing daily PE. And 29% of all schools, even though it says high schools, met the requirement for nutrition education. So we want to make sure that we are increasing that number for this year. Hopefully the data will say that. Again, this is the minute requirement for sexual health education and the policy. You can always go on our website, and if you are a CPS employee, you can find more information on the Knowledge Center. So for the minute requirement for sexual health education, grades K through 4 must implement 300 minutes per grade, and grades 5 through 12 is 675 minutes. And there needs to be a minimum of 2 instructors per school. That is mandate, and all schools must teach sexual health education. I know the schools are not doing it, but it is a state requirement. So schools have to teach sexual health education. Physical education, the requirement is for elementary and middle schools per the board policy, 150 minutes weekly, and then high schools have to offer daily PE to all grade levels. And then here is an infographic on how to actually achieve that minute requirement. And it must be taught by an actual physical education teacher, and any testing that is done for physical education that goes into Aspen, because we moved on from Impact and now we have Aspen to put in those fitness testing minutes. The Learn Well badge is majority of Healthy CPS. It is a lot of our wellness policies that exist here under the Learn Well badge, and we want to highlight the fact that only 48% of schools, based on last year's data, have an active wellness team. 47% of schools have an early childhood rep on their wellness teams, and only 58% of schools limited unhealthy celebrations for the school year. Now, a wellness team, the role of the wellness team is to convene quarterly and discuss health and wellness culture of your school, and then a wellness champion must be designated from every school by the principal. And that wellness champion is a CPS employee whose role is to promote health and wellness initiatives and create a healthier school environment for the students. And the wellness champion does not have to be a PE teacher, it can be any teacher, but it must be designated by the principal. And any of the following people in the school can actually be on the wellness team. But the requirement is to actually have a wellness champion, you must have a Medicaid designee, and you must have a delegated care aide, a parent or student or partner on your wellness team, as well as an early childhood rep. So those are the requirements. When it comes to the healthy snack and beverage policy, we want to make sure that schools are adhering to the best practices. For their students, I will advise to not celebrate with food, to not fundraise with food, and do not reward with food. But here are the highlighted best practices. As far as fundraising, the best practice is for schools to avoid fundraising with food during the school day. And the school day is defined as 30 minutes. The beginning of the school day is defined as 12 a.m. until the last school bell. That is a school day. So it's 12 a.m. until the last school bell. So if you would like to fundraise with food, you must do that 30 minutes after the dismissal of the last bell until 12 a.m. the next day. You have time to fundraise, celebrate, and reward with food as per the definition of the school day. The same goes for celebrations. So schools are allowed to pick 2 days or 2 events where they can celebrate school-wide. When we say school-wide, that means all classrooms participate, not individual classrooms. And making sure that if you are celebrating with outside food, be conscious of students with allergies, and making sure that everything, the ingredients are shown on what is being brought into the school. As far as rewards, schools cannot withhold food, PE, recess, or physical activity as a punishment. And schools are encouraged to offer physical activity as a reward for good behavior rather than rewarding students with food. So the policy best practice is schools should focus on rewarding students with fun rather than food. And our last badge is the health service badge. This one is pretty easy for schools to obtain as long as they're making sure that families know about the medical compliance deadline. And based on last year's data, 79% of schools actually achieved the medical compliance deadline, and that deadline is quickly approaching for this school year, which is October 15th. So we want to make sure that our families know how to access immunizations and physicals for their students, and a lot of that can be helped through our Children and Family Benefits Unit if they need access to Medicaid or SNAP benefits. So as far as health services here at CPS, we help our schools, again, with getting physicals, immunizations, primary health care services, sexual health services, care for chronic conditions, and dental services, as well as hearing and vision exams and screenings. Here's the number for the Children and Family Benefits Unit. Please visit the website at cps.edu, CFBU, and the number is easy to remember, 773-553-KIDS. And if you are interested in where to send families, here are the sites as far as like the North region, where they can go, and then the next slide will be the South region. How is CPS determined? So again, the survey goes out every spring. Last year, it was, I think, a week after spring break, I believe. This year, our deadline, we're thinking is April 20th, but don't hold me to that. And then during the summer, once the survey is taken, we go through a manual review, meaning the whole office gets together and we review every single survey, every single response. That is uploaded, even the blank pages that some schools actually submit, unfortunately. And then we go through the data analysis, which takes a while, and then there is a follow-up period for schools to actually refute any discrepancies that may have been answered or anything for the survey. So say if the principal did the survey and completed it very quickly, but they are not the wellness champion, so they don't know everything that goes on with in the school, we give the schools at least 2 weeks to refute that. The same goes vice versa. If it was a wellness champion, but they forgot something, and they answered something incorrectly, we give you a chance to dispute any discrepancies. And then the reports are published in the fall, and then there's also the Healthy CPS celebration, even though this year it was actually in the summer and not the fall. But the reports will be published this fall coming up. These are our data sources. So one, you have the Healthy CPS survey, then all data that is put into Aspen. So that is the fitness testing data, medical compliance, and BMI, a whole host of other data sources. And then the Learning Hub is where we do we get all of the data from the staff training. So again, make sure that you sign up for the sexual health education training, any safe and supportive environments training for our LGBTQ youth, and also the chronic conditions training. And then we get our data for our nutrition and support services that comes from Airmark. How does your school become Healthy CPS? Here's a great infographic, but I'll go through it. You achieve Healthy CPS by nominating a wellness champion. Again, it has to be designated by the principal. You establish a wellness team, monitor the required training completion status for all staff, periodically review the Healthy CPS checklist. We've updated that, so that will go out soon and be made available on our website. You create, share, and implement the action plan with our staff or with Healthy CPS partners, such as Healthy Schools Campaign. You schedule your health services to meet the medical compliance and dental compliance deadlines. You have to report your progress quarterly to the LSC. Refer always to the OSHW calendar. If you're a CPS employee, please bookmark the OSHW Knowledge Center page. And if you are an integral part of implementing Healthy CPS at your school, please make sure you subscribe and read the Healthy CPS Digest that goes out monthly. The October Digest will be the first one for this school year, and it will go out pretty soon. And then, as always, complete the annual Healthy CPS survey in the spring. As far as announcements, you'll be able to get the link to this, and you'll be able to download the Healthy CPS calendar. In the calendar, there's also quarterly check-ins, so you can actually go through and check off exactly where you are with your Healthy CPS progress quarterly, and it aligns to the actual CPS calendar as well. Make sure that, again, you have a pre-K rep on your wellness team, and if you need more information about StartWell, there's a one-pager here and the actual toolkit. If you need help with getting information on sexual health education to your parents, we actually created a parent curriculum connection. It goes through everything, the scope and sequence, and how to actually have those conversations with parents around sexual health education and what it should be done in implementing sexual health at your school. And around nutrition support services, there's this catering menu. This is for all of our schools. It is free to schools. It is for you to celebrate with. So if you have any upcoming celebrations and you want food, please use the catering menu. Again, it is free to schools. Like we said before, we would like for you not to celebrate with any outside food, but if you must celebrate with food, please use the catering menu. Thank you for your time. If you have any questions, please reach out to the Office of Student Health and Wellness. Here's our email address, our phone number, and don't forget to visit our webpage. Thank you.
Thank you very much. That was very informative, as always. We greatly appreciate you being a part of this webinar. And so just piggybacking off of what was just shared, we want to start with some initial steps to implementation. And the first thing we talked about was establishing a wellness team. So right now we want to offer this poll. How many of you have an active wellness team at your school currently? And for those of you, the next poll question, for those of you that have a wellness team, how many of you have a parent or a student representative on that team? So do you have a parent or student that is active on that wellness team? We do like to highly recommend that you have a parent or student on that team. For one, it is good to have the people at the table that you are acting on behalf of. So those would be the student voices are key. They can be very insightful in letting you know what the students would respond to and just giving you their perspective. We can go ahead and close that poll. And then also the parents may have some great ideas in helping you implement wellness policies. And also they can do some of the heavy lifting. Teachers and administration are very busy throughout the day, but if you can find some dedicated parents that are willing to assist, they can do a lot of the heavy lifting and take a lot of that off of your plate. And we know that no one cares about students more than the parents of those children, so really tap into that resource as much as you can. And another poll question, how often does your school engage parents in wellness initiatives before, during, or after school? So if you can answer that question for us now, we would greatly appreciate it. Like we said, parents are key in making a healthy environment, and so we highly recommend bringing them to the table as much as possible. If you find yourself that you don't normally engage with parents, maybe that is something that you can work on going forward. All right. So another thing that we spoke on was reviewing your school's alignment report. Sarita shared exactly where you can find that on the website. You will also want to start off the school year by filling out the Healthy CPS checklist and action plan. The Healthy CPS checklist looks like this. You can get this online. And as you're filling it out, I recommend filling it out via the PDF version on your computer. As you click yes or no, the action steps will come up next to it. Just because you clicked yes, do not just move on. Please read the action steps. There are things that you need to do to follow up with that. So as you answer yes and no throughout the checklist, each one will be broken down with a specific badge. You can then use that information along with what you have found in your alignment report to populate your Healthy CPS action plan. This would be something that you should fill out with your wellness team. I would recommend assigning a different person for the different actions on the action plan. That way no one is feeling overwhelmed. You do not want a situation where the wellness champion feels like they are going through all of their normal daily duties and having to do all of this extra work. So if everyone does a little, no one has to do a lot. This is important work, and we want to make sure that these initiatives are implemented. And you also want to take some time to review the CPS health-based policies. Those policies being the local school wellness policy, the healthy snack and beverage policy, the breakfast after the bell policy, and the PE policy. So make sure you're familiarizing yourself with those so that as you're advocating for this in your school building, you can have this as a tool saying that these are requirements from CPS, and it's not something that you're just making up on your own. It's not your personal preference. This is a policy mandated by the district. And moving forward, you would like to develop that fundraising plan. As Sarita mentioned earlier, you should not be fundraising during the school day with any food. So you want to make sure everybody is on board with that and knows exactly what those requirements are. And that will take a bit of planning because we are used to fundraising with food, and we want to be creative about not doing that. You also want to schedule some time to report to the LSC. Wellness teams should be reporting on a quarterly basis to the LSC. It would be good to just figure out exactly the LSC's when they meet and how often that you would like to report as a wellness team. I'd recommend picking some days in the beginning of the year so that you can hold yourself accountable and keep yourself on task. Make sure the school staff members are receiving the necessary trainings. I believe in this presentation there was the calendar that was there so you can see exactly where you can, when all those trainings are going to be available for the chronic conditions for your teachers. Make sure that they are taking those as early as possible. It is not just a checkbox that we want to have at the end of the year. I'm saying like, oh yes, it is May 31st and now we're going to take all of our trainings. This is important for the health of the students in your building, especially when you come to food allergies, and then if you're going to be teaching outdoors. You want to know where the EpiPens are in your school building, and you want to make sure everyone knows how to respond in the case of an emergency. I can't state this heavily enough. Children's lives are on the line here. We have had things happen in the past that were dangerous. We want to avoid those at all costs. So again, do not treat this trainings like a checkbox. It is important that everyone in the building knows what to do in the case of an emergency. We also recommend incorporating your wellness goals into your CIWP, that being your school improvement plan. We know that in schools, resources are allocated to the things that are in your CIWP. So please incorporate health and wellness goals into the CIWP to make sure that those are being implemented in your school building. And then you can also look out for further communications about this webinar series. So please stay in touch with me, and I'll be letting you know exactly when those times and dates are chosen for the remainder of the webinar series. And if there's anything that you would like to see us speak on in the future, please let us know that as well. And with that, I would like to open it up for any questions that you have at this time. So please feel free to chat using the toolbar on the side. If you have any questions, please send those through now. Here's one. Someone asked, where can one find the CPS wellness policies?
You can go on cps.edu and /policies, and they will come up there, and then you will be able to search for the policy.
Awesome. Thank you for that. Looks like we have another one that just came through. For the appeal process, who gets notified when it is time to have the appeal?
So whoever filled out the survey actually received the notification for the appeal process, and the principal of the school is also CC'd on that email. Only time that there may not be a principal is when there is a staff change. And we know if we get those emails bounced back, then we send it to the person who is the interim or the next person that gets the position there. But it's mostly all the time the wellness champion or whoever takes the actual survey.
All right, so we're going to leave space for a couple more questions. If you have any questions, please send those through now. If you are looking for some help in implementing your implementing wellness policies in the school building, you're looking for some outside partners, here is a partner list. These organizations have already been vetted by CPS. So you know that they are good to go. So they will help you with nutrition education as well as providing the physical activity that you need to implement in your buildings. So please contact any of these organizations and they'll be happy to help you out. And here are also some additional resources. Again, we will be sending out this PDF, so you'll be able to click directly on these links. There's the Healthy CPS homepage, the Learn Well Toolkit. If you need some ideas on alternatives to denying physical activity, because as Sharita mentioned earlier, we do not want to withhold any recess or PE class as a punishment for students. A lot of times it is that physical activity that they need to burn off that energy, and you'll find that you'll have less disciplinary issues if students are getting that physical activity, as I mentioned earlier. In Healthy Schools Campaign, we also have a Fit to Learn resource page where you can find some curriculum on some lesson plans on how to incorporate physical activity and nutrition education into your curriculum. And with that, if you have any questions going forward, please feel free to stay connected. Again, I am Kenneth Varner, and if you want to reach out to the Office of Student Health and Wellness, you can email them at oshw@cps.edu. And with that, I would like to thank you very much for your time. Sharita, thank you again for joining us on this webinar.
No problem. Thanks for having me.
And everyone else, you have a great day.